Hypogonadism is a chronic disease, and like diabetes, it needs to be treated for life. We found this in a different registry where we ran into problems with reimbursement, with the German reimbursement system. So the health insurances decided that the treatment wasn't really necessary. So patients were taken off testosterone for a year and a half, and all these parameters that we measured worsened again. So it was very, very clear that the effects that we had seen were results of testosterone treatment. Now with these type 1 diabetics in this particular registry, they were continuously on testosterone. And we saw among the improvements, or besides the improvements in glycemic control, we saw massive improvements in their anthropometric parameters. They lost weight if they were obese. There were quite a few obese men also among these type 1 diabetics. And they lost a lot of weight. In all patients, the waist circumference was reduced. And this is certainly a result of changes in body composition. As we know, testosterone increases lean body mass and it decreases fat mass. I think the most prominent patient group among the hypogonadal men are always the type 2 diabetes men. And we see in this registry, as well as in our parallel registry from Hamburg, that about 35% of all hypogonadal men presenting with all kinds of problems, urological problems, had type 2 diabetes. So 1 out of 3 men has type 2 diabetes. The other thing that is very, very frequently found is prediabetes. If we define prediabetes according to the ADA definition, HbA1c between 5.7 and 6.4, we find another 50%, so even more than the type 2 diabetics, of hypogonadal men to have prediabetes. Now with prediabetes, the interesting thing is that not a single patient who receives testosterone progresses to diabetes. So what we saw was that testosterone was 100% able to prevent the progression from prediabetes to diabetes. That is a very striking finding.